Friends and pals, pals and friends, strangers, welcome to my channel. My name is Maggie. I have Crohn's disease and I live with an ileostomy bag, which means my intestine sticks out of my stomach and my butt is just for show, which is really awesome. I know that I've been making a number of vlogs lately and I wanted to bring April back into a little bit more education because I get a lot of questions. I get some ridiculous questions and I thought maybe I could clear them up in one video. Probably not. I bet there's going to be a whole slew of questions below, but that is okay. I am glad that people ask these questions, but I wanted to make an all-encompassing video for proctocolectomy surgery, aka having your colon, rectum, and anus removed. This is the video that I would send to friends that are possibly going to get this surgery and they're just wondering what to expect. And this video is also meant for the people who are curious. I get a lot of people that have never heard of ostomies or Crohn's disease or any of that see my videos that talk about me not having an anus, and people are like, that's cool. So I'm going to hit all of the hard questions like, can I have kids? Can I have sex? Am I dying? Will I die because of this? How do you live without a colon? All of these questions that I think both people that may have this surgery and people that will never even meet somebody who has this surgery might be curious about. So we are going to get into it. Before we get into it, I do want to say, I made a new Instagram account. Instagram decided that I was just too offensive and deleted my account on me. So if you want to follow me on Instagram, I think I'm going to take a little different approach on it this time. But my name on Instagram, it's the only one that's going to be different because I can't claim Let's Talk IBD. You will find me as Maggie Tretton on Instagram. So if you want to go follow me there and follow the behind the scenes from YouTube, you can do that there. Anyways, I wrote some notes on my phone, so I'm going to pull them up to make sure that I hit everything basically that I've been asked or questioned about. This is really me reviewing proctocolectomies, giving you my true and honest thoughts. Hopefully this is helpful for some of you who are lost in space with this. So I'm going to start off by going over a little bit of the GI anatomy, not super hardcore into it, but the brief overview of what GI anatomy is, so it'll give you a better understanding of why my surgeons did the things that they did, because I'm constantly asked, why did you not get a J-pouch? Why did you not try BCIR? Why don't you just get reversed and get rid of your ostomy bag? So very, very brief GI anatomy. You have your mouth that goes to your esophagus, that goes down to your stomach, that goes to your small intestine, and then goes into your colon, then goes to your rectum, and finally your anus. So when you eat food, it goes through all those parts, and different nutrients are pulled from different parts of the intestine. So with my disease, my body attacks my GI tract. It could attack it anywhere from the mouth all the way down to the anus. My disease mainly presented in my colon, my rectum, and my anus. I received my ostomy over 10 years ago, and it basically allowed me to not use my colon, rectum, or anus. It was just the end portion of my small intestine being brought outside of my stomach where I wear a bag, and then everything else, the colon, rectum, anus, having a break for 10 years. I always get asked, how does that function? What does it do? Anything that you do out of your anus, I do into my bag. And we will leave it there. Despite the 10 plus years of rest that all of those pieces were having, things did not get better. My rectum became very scarred and strictured, meaning it had very narrow portions of it that were irreversible. There was no way of fixing that. Some people are able to have portions of their rectum removed, and when we talk about a rectum, it's basically a reservoir for stool to be held. Some people can be fully connected with only a portion of their rectum, and the body and the rectum and the intestines all adapt to kind of fit your new way of digesting things. The reason I never got a J-pouch or anything that used my rectum or a pseudo-rectum, because you can make sort of a pseudo-rectum out of small intestine, the reason that never happened was because my anus was so damaged as well. If I took a handheld mirror and put it back there, I could see Crohn's disease. That is why in 2019, at the end of 2019, I decided, let's get all of this out because I'm not even using it. I haven't been using it in a decade. Let's get her all out and be done with her. That was a long explanation. But I wanted you to understand why I didn't go other routes, because some people live very successful lives with J pouches where they are fully connected just with some different pieces doing the role of their old organs. I always get asked, are you dying? Will you die sooner than you normally would have? And the answer is no. You do not need a colon to live. Colons are very helpful to you. You do not need it to live, and you have probably met somebody who does not have a colon. Very broadly, a majority of the small intestine absorbs your nutrients. A majority of the colon's job is to absorb fluids. So because I don't have a colon, I'm at a much higher risk of getting dehydrated. But because I've had my ostomy so long and I've been using my small intestine for so long, it adapts over time, and my small intestine absorbs more fluid than the average person's does. I also drink a lot of electrolyte-containing fluids to make sure that I am staying on track and not getting dehydrated. Of course, some people do have a lot of trouble when they don't have their colon and they require getting IV fluid somehow. I am fortunate enough that I don't need that. I also get some people that say, did your surgeon push you into this? Did your GI doctor push you into having your proctocolectomy? Why would you ever choose to have that? It was actually the opposite. I pushed my doctors into doing it. I was miserable. Even though I had an ostomy bag and I did not go to the bathroom like you would, if you're all connected and whatnot, I was spending more and more time in the bathroom because my colon was just producing this disgusting mucus that I had to constantly pass. I was having trouble passing it because of the stricture. So I was fed up with it. It felt like I had to go to the bathroom all the time. So I went to my GI doctor, and my GI doctor referred me to a surgeon. I went to the surgeon and said, I think I need a colectomy. I think you need to take all this out. And he said to me, well, let's just take a look in there and let's just, search around, because if we don't need to do it, I don't want to do it to you. And I was like, all right, that's fine, but I'm pretty sure you're going to want to do it too. I'm pretty sure you're going to agree with me when you take a look in there. And the second I woke up from that colonoscopy, he was like, yeah, so let's schedule that surgery. Did I have other options that I could have done? The only thing that I think they may have tried, or they would have been willing to try with me, is a fatty acid enema. Essentially, when you do not have your colon in use, your colon is not getting certain nutrients that it needs and can develop something called diversion colitis, which can be very hard to tell the difference between diversion colitis and Crohn's disease. After I had the colectomy and they sent my colon and rectum to the lab, they discovered that I did in fact have diversion colitis. So could I have maybe reduced some of the inflammation with these, basically it's fatty chain acid, I don't know, these special enemas that have the nutrients your colon needs. Could I have reduced some of that inflammation? Possibly, but I had scar tissue, which is irreversible. It was totally strictured in my anus. So no matter what, if I got rid of that inflammation and I got reversed, I would have had a lot of trouble, like I did prior to ostomy surgery. I do not talk about it a lot, but I had a lot of anal leakage. My anus did not work. It did not work like it should have. It did not hold in what it needed to, and I spent my early teens constantly wearing pads because I was constantly leaking out disgustingness, and it was horrible. Hence why I will never go back to that life. Well, I can't now. I don't have the pieces. How did I make this decision? Because this is a scary surgery to have, and I'll be totally honest, it was way more scary than ostomy surgery to me. I'm very fortunate to have a number of friends that have gone through this. If you guys know Joe and Danielle at Double Bagging It, you can find them on Instagram and Facebook and YouTube. They're close friends of mine, and I remember going to them. We had a conference that we all went to in Las Vegas, and I remember exactly where we were in the hotel, and I was like, Danielle, what's it like? I'm thinking about getting this surgery. What is it like? And she really calmed my fears. The other thing that I did, because I do know a lot of people have had this surgery, is I looked at the not so good stories either. I also follow Kristen's Chronicles on Instagram, and she had this surgery as well, and she has had an open wound for I think a couple of years now. So I went into this surgery very honest with myself that it may not work. I may have to have another surgery to heal the incision of where my anus used to be. So yes, I was aware that things could go wrong, but they could also go really well. What was it like early post-op? Not great. Not great at all. Pretty horrible, I will be honest. But I had also mentally prepared myself for that, and I'm a nurse, so like I've seen patients after surgery, and I know that when you first wake up, it is the scariest and most unsure you will feel about yourself ever. You are afraid of your own body because you're like, if I move this way, am I going to rip something, or am I going to dislodge something? I prepared myself for that as well, and that first night was really horrible. I barely remember it, thank goodness, but I do remember I had this male nurse, and of course I did, when he had to check my butt all night long. And he was cute too. Oh well. I remember laying on my side all night, and you can't put any pressure on your butt at all right after this surgery especially. So I remember lying on my side and having this nurse, be like, oh, we should turn you. And I'm like, I'm afraid to. But I was so uncomfortable because I tend to flip sides all night long just to, take pressure off different parts of me. And I felt like I couldn't, and I was going crazy. But that got better every single day, every single night after surgery. I also told myself, and this is what I tell patients, or I did tell patients when I was in the hospital working, make it a goal to get rid of a medical device every however often. So after that surgery, I had, I think, 2 IVs. I had a catheter in. I had at least 1 drain, I believe. Yeah, I had a drain coming out my left side. So, like, you're connected everywhere. Plus, they have the blood pressure cuffs on you and all this stuff. So I made it my goal to be like, all right, let me get drinking fluids, so that way they don't have to run IV fluids as often, and they can disconnect me from the IV. And once I get to being comfortable on oral pain medications, that IV can probably come out. And let's try and get the Foley catheter out, prove to them that I'm peeing enough, and that's kind of how I got through it. I was like, I'm gonna try and get something out of me every few hours or every day or so. Hey guys, while I'm sitting here editing, I just wanted to add one more little tip because I know that people have questions about this. As a lady who had to obviously pee after surgery, it's super awkward because you don't want to have anything getting your dressing wet. So basically all I could figure out to do was lean forward when I use the restroom. I have I have a pee funnel for ladies, which you might want to try out. I never did. Maybe that would be useful for you. Something to think about, but I did want to add this in because I have been asked that a number of times as well. And I was only in the hospital for 3 days, so it was really good. I was very skeptical when they told me that I would only be there 3 days, but they were right. How did I sit after surgery? I did not sit. You do not sit after this surgery. You can kind of lean on one side or the other. A waffle pillow. If you go on Amazon and type in waffle pillow, you can find good ones for like $20. They are a godsend. The nurse practitioner that I used to work with recommended this to me, and I am so grateful that she did. She said, blow it up about halfway because you don't want it so firm that it's pressing into your wound or your incision, but have it halfway blown up so you have a little bit of wiggle room with it. And that way when you're on it, you can kind of like tilt back and forth and take pressure off of your different sides. I also had real stitches in, which I did have a video up. I'll have a whole playlist on my proctocolectomy journey where I go into detail about a lot more of these things, but I had real stitches rather than the dissolvable ones because I have a history of dehiscence of my incisions, which just means splitting apart. And even with the real stitches, it still split apart eventually. It took a couple months. It was like, I had the surgery at the end of December, and at the end of February, my incision split open. But the real stitches were so uncomfortable because you just feel it pulling and tugging every which direction. I think I had them for a couple of weeks, and I posted a video where I had them removed, and I will tell you that was the worst pain I have ever experienced. A lot of people are like, why didn't they put you under, and why didn't they numb you, and all this different stuff. Why didn't they put me under? I didn't ask them to. It was an option. They said, if you're able to handle it in office, awake, we'll do it. I was able to handle it. It was horrible, but I got through it, and it was great, and there was no recovery time. Why didn't they numb it? The tissue all around that area was breaking down and horrible. I just can't see them injecting numbing agent into that situation. If you could have seen it, I think you would have understood more why they didn't do that. I do think that the real stitches made a difference. I think it probably would have split a lot sooner with dissolvable stitches. And it took a really long time to heal. It took well over a year for that incision to heal where my anus was, but it healed. It did heal. I think around the 30-day mark, I started to be able to put more pressure on it, and a couple of months later, I would say by maybe a month and a half, I was sitting fully. How long did it take to get back to normal? Again, around a month and a half. I was able to go out to California, because that's actually where I split the dang wound. I was able to fly out to California by myself, sit on an airplane for 6 hours, and be okay, other than it splitting. Editing Maggie again, I did want to explain a little bit, because I had some jerk recently say that I lacked common sense because I was moving too much after surgery and it split. That's probably true. I probably was moving too much, and it had it split sooner than it would have. I do think the dang thing was going to split open anyway, and also, should I have laid on my backside for a year waiting for this stupid thing to heal? No, I wanted to live my life, and yeah, I had to deal with a wound for quite a while, but in reality, it really did not mess with my life too much, so just wanted to put that in there. Thanks, guys. But you gotta live your life, and sometimes that happens. For the wound itself to heal, it only just healed like recently, so, and it's not perfect. It definitely isn't perfect. For a long time, it had a lot of drainage, it was deep, and then it got shallower, and then it would get deeper again. You have to be very consistent with the wound care on it if you have trouble with that wound. I essentially got it to heal by using gauze, Meta-Honey gel, and the silver gel. I did not see wound care. It wasn't offered to me, but I would have asked if I felt like I needed it, and I was getting very near to asking for help with it. I had a lot of you guys recommending like hyperbaric oxygen therapy, which is super expensive, and I didn't want to go that route because I didn't want to do a wound vac because, wow, that would be super uncomfortable in that spot up my butt. But I'm thankful I got it to heal. It's still a divot, but it'll probably always be at least somewhat of a divot, and even with my big midline scar, that took a couple of years to fill in, and it didn't really fill in completely, so I am satisfied with where it's at. I place a small piece of gauze in there every morning. It usually falls out the first time I go to the bathroom, and I don't worry about it anymore. I also made a video about the problem I was having with my periods, and basically what was happening is any discharge I was having, whether it was regular monthly discharge or my period, it would seem to collect in me and then come out all at once. So I made a video talking about that, and I had so many great suggestions. So I made a video about why that was happening, and something that I really didn't know or I wasn't told before my proctocolectomy surgery is that your rectum gives a lot of support to the uterus and all of your organs inside of you, particularly for females. And when you remove it, things get kind of messed up in there. So I was having a lot of discharge problems. I got bacterial vaginosis because of it. We thought that that was just like the problem. I got that, or I got a yeast infection, and that was causing the excess discharge, and it was actually because things were pooling inside of me, it was allowing that infection to build up, and then I would be able to clear the infection, but I would still be having the discharge. It was a crazy mess. So many of you guys gave me great tips, like try using a period cup, which I am now using. I'm not using a cup like the silicone cup, but I'm able to use a disc. I haven't retried the period cup yet. I'll have to go back to that or try a softer one. And the thing that has really helped way more than I thought it would was pelvic floor therapy. I 100% recommend going to pelvic floor therapy, whether you are a man or a woman or whoever you are getting the surgery, go to pelvic floor therapy. It is meant for everybody, so it is fantastic. I didn't know how much it would help, but basically what my pelvic floor therapist found was that when she would go to inspect inside of my vagina, she's like, there is a pocket, like there is a clear pocket I can feel where I'm going to guess that collection of fluid is happening, and then once it fills up, it's coming out. I was just amazed. And she also said that my muscles were so tense in there because I was trying to like make up for the support that I no longer had from my rectum. So we were able to loosen up everything inside of me. My dang camera cut off, probably mid-sentence, but she was able to work on other muscles of my body, which has helped immensely, especially in the bedroom. So obviously, immediately after surgery, I could not have sex for about 2 months. It was very painful because where they sewed up one hole, it's right next to the other. So I could not, like, no, don't come near me, go away, shoo shoo. And it was very difficult to, I wouldn't actually say very difficult, but it was getting better. It was improving on its own, comfort-wise, but I was still very nervous about possibly having pain where my rectum and anus were, that I would like tense all my muscles during intimate moments. But because of pelvic floor therapy, things are relaxed now, and I am just like, it's a world of difference. Ask Zach, it's a world of difference. And the final question that I probably get the most, and I do plan on making a video more in detail about this. Can I have kids? I don't know. I really don't know. People often assume that I cannot have children, or I will become very sick and ill if I have children. That is not necessarily the case. If you guys are interested in somebody that has an ostomy, has had the same surgery as me, EMC Brown, Megan is her name, on Instagram, has had a baby, a pregnancy with an ostomy, with the proctocolectomy surgery. She's had pretty much the same stuff as me, and she had a baby. She has a little girl, so it is 100% possible. I don't actually see it a whole lot online. I have friends that have had pregnancies with ostomies, but I haven't seen a whole lot of people fully document the experience. So I have looked because I would like to know somebody else, and I have a really good friend that has had 2 pregnancies who's willing to talk with me. Not a lot of people that talk about it online in a public way. So for me, myself, I was told we could try for 6 months because I do have regular cycles, which is really great. And if nothing happened, I would go back to the gynecologist and I would get a hysteroscopy, which I believe, this is a whole new field for me. Basically, they would search to see if my fallopian tubes were blocked at all. It is very likely that they are, because I've had a lot of scar tissue in my belly and that can affect the fallopian tubes. But that's not to say that they definitely are. I won't know until I know is what I'm going to tell you. Okay, hopefully I have answered all of the questions. All of them. Really hope that I did. I've gotten so many since I posted a few different videos that for whatever reason, people are just like, that's a cool topic to watch. Hopefully this helps clear things up for you. And you know a little bit better what it's like living without a butt. Alright guys, I hope that you enjoyed this video and I hope that you are feeling good, and I'll see you in the next. Bye guys.